Hello everyone, this is Ola. Welcome to part 4 of the neurophysiology, which is a fun part because here we will discuss the neurotransmitters. So we have a group of neurotransmitters that we call monoamines. As their name indicates, monoamines means they are derived from amino acids. The catecholamines are the group of monoamines that is derived from the amino acid tyrosine. Catecholamines include dopamine, norepinephrine, and epinephrine. So if you don't have enough tyrosine, you will not produce enough of these three important neurotransmitters. Serotonin is the neurotransmitter derived from the amino acid tryptophan, and this is found in abundant amounts in turkey meat. And serotonin is the neurotransmitter that makes you happy and relaxed. So sometimes when you eat a lot of turkey during your Thanksgiving night, you feel kind of relaxed. And maybe you say, okay, let me relax and skip the Black Friday shopping. Histamine is the neurotransmitter that is derived from the amino acid histidine. So from here, you can conclude that diet is very important so that you have enough neurotransmitters. So if you look at tyrosine through a certain reaction produces DOPA. Then DOPA produces dopamine neurotransmitter. Dopamine neurotransmitter by an enzyme, which is the dopamine beta hydroxylase, becomes norepinephrine. And then norepinephrine can be converted into an epinephrine. Monoamines are the neurotransmitters that, after finishing their job in the synapse, they must be taken back into the presynaptic cell. So the monoamines, after doing their job here into the synapse and activating the postsynaptic cell, they are taken back here into the presynaptic cell. We call that reuptake of the neurotransmitter. After being taken back into the presynaptic cell, they are inactivated by the monoamine oxidase enzyme. So it is an enzyme that breaks down the monoamines in the presynaptic cell. Please do not confuse that with acetylcholinesterase enzyme, which is a synaptic enzyme. So acetylcholinesterase breaks down acetylcholine here in the synapse. But monoamine oxidase is not a synaptic enzyme. It works here into the postsynaptic cell. Serotonin is the neurotransmitter of happiness and relaxation. And it is a monoamine derived from the amino acid tryptophan. There are specific serotonin reuptake inhibitors. They are the group of medications used to treat depression. Why? Because they prevent the reuptake of serotonin from the synapse. So serotonin stays in the synapse, keeping you happy. There are over a dozen of receptors responding to serotonin. So serotonin has a lot of functions. In addition to keeping you happy, it is also important to keep you relaxed, so it relieves anxiety. It is also for appetite control, and also if you don't have enough, um, this can lead to migraines. That's why specific serotonin reuptake inhibitors are sometimes given to patients with migraine headache. So here is serotonin in the synapse. After doing its action, it must be taken back here into the presynaptic cell. So specific serotonin reuptake inhibitor, they block the reuptake receptors. So serotonin stays here in the synapse at higher level. The neurotransmitter dopamine is the one that facilitates focus and motivation. It helps you to focus, and it is derived from tyrosine. Also, dopamine controls movement. It is very important for the emotional response and ability to perceive pleasure. So people who are sad are not able to be happy. Nothing, makes them happy. Maybe they do not have enough dopamine. Also, dopamine helps to focus. If there is a lack of dopamine, then learning, attention, and memory can be impaired. So here, ADD and ADHD conditions are associated with a decreased level of dopamine. When the basal nucleus is damaged, Parkinson's disease happens due to lower level of dopamine. On the other hand, high dopamine level is associated with schizophrenia. So lower level is associated with Parkinsonism, ADD, impairment of memory. Higher level is associated with schizophrenia. Coffee causes dopamine to be pushed into the synapse to improve focus. So when you drink your coffee in the morning, you feel kind of focused because the dopamine now is at a little bit higher level in the synapse. Let's think here. Parkinsonism is associated with low levels of dopamine. So how can we treat that? With a dopamine agonist or with dopamine antagonist? Well, there is a low level of dopamine in Parkinsonism, so it is treated with dopamine agonist medications. On the other hand, schizophrenia is associated with high level of dopamine. How can we treat that? We need to decrease the level of dopamine in case of schizophrenia. So the treatment is to give dopamine blockers like clozapine. Sometimes people with prolonged schizophrenia, because of taking dopamine blockers or antagonists, they develop movement disorder, which is kind of mimicking Parkinsonism. Dopamine and cocaine. Cocaine blocks the reuptake of dopamine. Remember that dopamine comes from tyrosine, and then dopamine can be converted into norepinephrine. Norepinephrine can be converted into epinephrine. So, as a result of cocaine addiction, the level of dopamine, norepi, and epinephrine increase in the synapse. And when the person stops suddenly sniffing cocaine, what will happen here is that as a result of the abrupt decreasing level of dopamine, severe depression can happen. And also, the heart rate decreases too much suddenly. On the other hand, people addicting cocaine are at the risk of developing heart attack. Why? Because remember that epinephrine nor epi stimulate beta 1 receptors in the heart, leading to heart rate increase and force of contraction increase. So if this is severe heart rate increasing and contraction, this can lead to a problem in the heart. Let's go over some review questions. So monoamines are derived from what amino acid? From the amino acid, monoamines are derived generally from amino acids. Catecholamines are derived from what amino acid? From tyrosine. Catecholamines include three neurotransmitters. They are dopamine, norepi, and epinephrine. Serotonin is a monoamine because it's derived from the amino acid tryptophan. Histamine is derived from the amino acid histidine. What happens to the excess monoamines in the synapse? Two things. Number one, they must be taken back into the presynaptic neuron. Then they are broken down by monoamine oxidase enzyme. If you compare this to acetylcholine, what happens to excess acetylcholine in the synapse? They do not go back into the presynaptic cell. There is no reuptake. They are broken down by the synaptic enzyme, acetylcholine esterase enzyme. Specific serotonin reuptake inhibitors keep high level of serotonin in the synapse, thus helpful in treatment of depression. Parkinsonism can be treated by a dopamine agonist. Now with the now with the neurotransmitter glutamate. Glutamate is the excitatory neurotransmitter in the brain. So it is important to keep you awake, to help you to remember and learn. However, large amount of glutamate are toxic. This happens if there is a stroke and then glutamate leaks out from the damaged cells, and as a result, it kills the nearby neurons. Substance P for pain. This is a neurotransmitter for pain. So the substance P transport pain signals to the CNS. It's been theorized that it plays a part in fibromyalgia. Also, substance P stimulates the vomiting reflex, leading to nausea and vomiting. Capsaicin lowers substance P level, so it is used as an analgesic. Chemotherapy-induced nausea and vomiting can be treated with substance P antagonists. Endorphins and enkephalins are the neurotransmitters associated with pleasure and euphoria. They are naturally occurring substance and they block pain sensation by preventing the release of substance P. So they are natural substance P blockers. You can increase your natural level of endorphins by exercise. Chocolates also increase that, chili peppers, and meditation as well. What are the enkephalins and endorphins agonists? They are the opioid agonists, like tramadol, pethidine, oxycodone, morphine, all of that medications. So those are pain medications. However, they are highly addictive. Glycine is the inhibitory neurotransmitter, is at the level of the spinal cord and brain stem. So remember that when you contract a group of muscle, the antagonistic group of muscle must relax. Why? Because the spinal cord gets signals going to the antagonistic group of muscles. Glycine neurotransmitters is released, leading to relaxation of the antagonistic group of muscles. Strychnine toxin is an antagonist to glycine. That's why it can lead to death because of severe contraction in all muscles at the same time. Glycine is often released with GABA, which is the inhibitory neurotransmitter in the brain. So glycine is the inhibitory neurotransmitter in the spinal cord, but GABA is the inhibitory neurotransmitter in the brain. So in the brain, what is excitatory? It is glutamate. And what is inhibitory in the brain? It is GABA. In the brainstem and the spinal cord, glycine is inhibitory. What is the neurotransmitter for pain? It is substance P. What blocks substance P release? Endorphins and enkephalins, and they are natural substances.